very, very warm welcome to all of you today. It's so great to see our guests and our faculty and staff, but I have to admit, the students steal the show.
Yes.
And we're going to be talking about you in a moment, but to see you in your coats is quite an extraordinary moment for me. We're very pleased to greet all of you today and to announce a very special grant. But before I do, I want you to know that this is BayPath's 115th anniversary. And so we're celebrating so much in the year 2012. We're also celebrating the launch of the Physician Assistant Program. So when we received news that we were a recipient of a HRSA grant, a Health Services and Resources Administration grant, we were thrilled because it is one of the largest grants that BayPath College has ever received from the federal government. And the gentleman to my left is very much responsible for helping us with this grant. I also want to acknowledge the special guests that we have here today because without their help, without their foresight, this program would never have become a reality. So if you'll indulge me for just a few moments. First and foremost, obviously we had to have the Board of Trustees approval and the leadership at the top. Roberta Baldock, please raise your hand, our chair of the board, and our vice chair, George Keaty, I know he's here as well, and Robin Newhouse, who was the first board member who gave financial assistance to launch this program. Those three members of the board I wanted to particularly recognize today because you must have a board's approval and you have to have their encouragement and enthusiasm to make any program work at BayPath College. And then obviously the faculty and most important, the director of the program. And I'm really thrilled to say that when we were able to hire Dr. Jennifer Hickson away from Mass College of Pharmacy, it was quite a moment for the provost, Melissa Morris-Olson, and for me, because we knew we had a star and we knew that this program would go far. And from there, she hired the faculty and the staff, and they are extraordinary people, and Jennifer is going to have the distinction of introducing each and every one of them to you in a few moments. But writing a grant is a very difficult process. And I want you to know that Jen had an incredible partner who was the major reason, I believe, we received this grant. Janine McVeigh, our Director of Corporate and Foundation Relations. Where are you, Janine, in the bright orange? We have to keep Janine very happy because she writes a lot of our grants. But when she called me, I was overseas, and she said, we have to call you. We had to call you overseas. I hope you don't mind. I said, do I mind when you're telling me that we're getting $999,861,000, you know, $1 million? I said, I'll throw in the 100 plus to make it $1 million so that I could announce that we got a $1 million grant. But Janine is extraordinary. Our Dean of Arts and Sciences is here as well, and the PA program reports in there, and that's Dean Michael Koenig right here. And I also want to thank you for when you look around this facility, you need to know, it takes a village to create anything at a college. And Mike Gianpietro and his staff did a beautiful job. Mike is here. He is our CFO, our Chief Financial Officer, the VP for Finance and Administration. And when I look here, I think I'm at Bay State Medical Center in the emergency room. So Mike, I thank you very, very much for the great work on the reconstruction of the lower level here and the other classrooms. He's back there, he's a modest gentleman. And the other individual on my executive team, Kathleen Burke, who, without Kathleen, who's done the fundraising for the Physician Assistant Program, I don't know what I would do. Kathleen Burke, our Vice President for Advancement. And I hope Paul Santinello is here. Is Paul here from Long Meadow? No. Well, Paul Santinello is the chair of the Board of Selectmen. He was on his way. I hope he gets here to enjoy this moment. But obviously, you have to have good town gown relations. And we do with the town of Long Meadow, and we wanted to thank Paul. And last but not least, all of the community health partners that are working with us on this grant and the launch of the program. Jen Hickson, our director, will be announcing them in a moment. But let me just share a little history, because I think it's critical to all of you about why we're doing the physician assistant program at Bay Path College. In Vision 2013, we put a blueprint for the future together, and we knew that health studies would be one of the critical key centerpieces for us. When we began looking at the vision, a doctor in town who really believed in the college and saw what we were doing and our growth and development asked to meet with me. He had a few ideas, and I read his letter, and the last sentence of his letter said, "And by the way, has Bay Path considered a physician assistant program in that Vision 2013? So I looked at the letter and I invited him in. And that's Dr. Robert Hoffman, who is one of the leading doctors in our community, and he's here today somewhere, and Jen will introduce him. So he came in and we had a chat, and it was, for me, very eye-opening, because he shared with me what his perception of the physician assistant role would be in the future of healthcare in our communities and in our country. At the end of the meeting, I said to Dr. Hoffman, "So, Dr. Hoffman, you actually might be interested in teaching as a second career?" And he said yes. Well, we convinced him. He is now a full-time member of our faculty. But we went on to bring together a group of key people in the community, and we brought a feasibility study to fruition, and we knew we had to go through a very steep hill through the accreditation process. I often identify this as creating a mini medical school. And so we had to go through the ARC-PA, which is the Accreditation Review Commission body, and it's a very tough, long process, a couple of years in the planning process, in the creation of this facility, and in the hiring of the faculty. And I must tell you that when we received our visit in March of this year, or in December of this past year, December 11th, and they left with a flawless report. A flawless report. I want to repeat that. It was a flawless report. They didn't have one recommendation when they came to visit us. Not one recommendation in our report, how we were going to handle the curriculum or the facilities. They said it was unheard of. And I have to thank our faculty and staff for creating that flawless report. And then in June, we welcomed our first class of 24 men and women who joined us. Just look at those bright new faces. And a critical part of this is not only getting the talented and very smart group of young men and women and to be partners with us, we needed to find community healthcare partners that would also be interested. And that's been the goal of the program. If you were to ask Jen Hickson, she would say, we are community-based. We are in this community, we are going to recruit from this community, and we are going to serve this community. And so the grant, to me, is really the pinnacle of that vision and that passion for working with our community partners. The grant is 5 years. I misspoke, it's $999,841. So I'll have to give $159 to make that the $1 million. We are one of only 12 programs in the United States that were granted this wonderful, wonderful grant. And I believe we're one of only 2 that are new physician assistant programs in America. I think that deserves a round of applause. What will this grant do? Well, it's certainly going to make an impact on the critical health care in our communities, because it will educate and train the physician assistants to work in many of the underserved communities in our region. It was interesting when I looked up where we place in terms of health care in Massachusetts, in Hampden County in particular. We're ranked last among the 14 counties for poor health statistics. So I think the federal government realized that we would have an impact if we had our physician assistants in the field working with all of our community partners. So this grant will bring direct care from our physician assistants to these underserved communities, and it will also provide opportunities for our PAs from our clinical partners to have a dual role as adjunct faculty members in the classroom so that they can pass on their knowledge. And the grant, and I think this is very critical, will help us to recruit more minorities and veterans into the physician assistant program. So know that surely the $1 million is an absolutely incredible achievement for BayPath. But I think the most important thing is that we will be changing and impacting the lives of our community from a healthcare aspect. So now it gives me great pleasure to introduce a friend of BayPath College. And this is a gentleman that we're very honored to have with us today. As I said, Congressman Neal, Kathy Burke and I met with him and Angelon in his office a couple years ago. We told him what our vision was. We said, we're going to need your help. And he has never, ever, ever refused that call for help. As you know, he serves the 2nd Congressional District. He's been doing that for, is it over 2 decades?
Well over.
Well over 2 decades. But he was the mayor of Springfield. Was it 84 to 80?
83 to 88.
83 to 88, the mayor of Springfield. And I happened to be with my nephew, who works in Washington, D.C., this weekend, and I mentioned the HRSA grant. And he said, oh, I know, and he knew just exactly what the acronym meant. And he said, so what congressman helped you out? And I said, Congressman Neal. And here's what he said to me, and I want this in the press. Because this is from somebody who doesn't live in Massachusetts. He lives in Falls Church, Virginia, but he works in Washington. And he said he is one of the most respected congressmen because he is steady and he is focused on his constituents. I said, I'm going to see him this week and I'm going to quote you. And I did. So I'm giving attribution to my nephew, Thomas Leary, for that. But I'd like to thank the congressman and his staff, and I would like you to help me welcome him to BayPath College today.
I mistakenly brought my phone with me. The staff will tell you I'm meticulous about leaving that phone in the car when I'm at a public gathering. So the last thing I wanted was to interrupt what was a terrific announcement today. Word of congratulations to President Leary and the staff here at BayPath, and to acknowledge the role that the modern president plays in terms of academics, fundraising, and marketing. And it really is a major role for the college president in terms of advocacy, to offer proposals that stand up under the magnifying glass of critical analysis. So great credit goes to the professional staff here for the development of the application, which despite congressional input still has to stand up under the magnifying glass of critical analysis, because they're measured in terms of comparing and contrasting with similar proposals that come in from across the country. Now, I'm going to just go on for a little bit here because of the students that are here, as we acknowledge the role that the staff and faculty have played here and the growth of BayPath over many years. I've earned a PhD in healthcare over the time that I've been in Congress because of the committee that I serve on, the Ways and Means Committee. We do trade, tariffs, Social Security, Medicare, Medicaid, pensions, and welfare, and there are only 41 of us. So it gives you a chance to really learn something, as I have. So I'm a veteran of the Clinton healthcare battle, and the Obama healthcare battle, and in between the Bush healthcare battle, because there were major changes there with the prescription drug benefit known as Medicare Part D. But the partnership that was acknowledged today by President Leary is really substantive. The role that healthcare plays in this valley, not only in terms of first-class institutions, but just as importantly, in terms of attracting some of the best people you're going to find anywhere in America to live here and to raise families. Now let me give you the economic argument. I'm going to come back to the preventive side as we discuss continually the Affordable Care Act. Medicare is the engine of economics in this valley. Bay State Medical Center, 11,000 employees. Revenue estimated to be somewhere around $1.4 billion. A teaching affiliate known as Tufts Medical School partners with Bay State every day. The Sisters of Providence, 5,000 employees, and they don't turn anybody away, either one of those institutions. The community hospitals across the region, whether it's in Northampton or as far as I go into 495 into Norfolk County with Milford Regional Hospital and the Dana-Farber Cancer Institute. My point is that you're going to have this great opportunity because with the Affordable Care Act, much of the emphasis is going to be on preventive care and trying to catch a young individual who is having trouble with obesity, just as an example, and to see what happens with hypertension as that becomes a much more expensive treatment as time goes on. The idea of this preventive care measure came based upon statistical data that was so far-reaching in terms of catching these diseases at an early stage, monitoring and treating them with the help of physician assistants. For women that are here, I just want to say this, and I can say this boldly. When you look at the preventive services that are in the Affordable Care Act, after you go through it, if you want to complain, then call me. My guess is you're not going to call. Osteoporosis screening, ovarian cancer screening, breast cancer imaging screening, mammography screening, all of these things are in there. And guess what? To all of you, they've already kicked in. They're already there right now for you to take advantage of. No longer will a child who's born with diabetes not be able to get health insurance. A major consideration. Another statistic that bears noting, half the bankruptcies in America, half, are healthcare related. People get sick, they lose their job, and they lose everything. That's a statistic that bears noting in this discussion as well. At Bay State Medical, at Mercy, Sisters of Providence, and all the community hospitals, this is a really compelling number. Half their revenue comes from Medicare. Half their revenue comes from Medicare. So just do the quick deliberation that I've offered. $1.4 billion, half the revenue from Medicare, and throw in another 10% to 15% for Medicaid. Medicare is the closest we've ever come in American history to universal health care. It's this great club. You turn 65, you're in. No test of gender, no test of race. Nobody ever asked, what's your religious affiliation? And when Lyndon Johnson signed that Medicare Act in Harry Truman's living room in 1965, he put us on the path to making sure that our seniors are well taken care of. Now the quest for all of us is, what do we do about those who aren't in the status of senior age? And the role that you're going to play as physician's assistant is going to be terribly important to these considerations. I also want to recommend to the staff, because you did such a great job with the grant application, another very important part of this. We fully acknowledged that some of the challenges that might confront New England would be different than perhaps the Midwest. So there are a series of regional demonstration grants that are going to be written and scored similar to the HRSA recipient that you are today. And it's going to be an opportunity to do some experimenting. We're not saying that we know it all. We're suggesting instead that those of you in settings like this, academic, medical centers, you can have a chance to do some experimenting and say, we think this might work well here. Now, one of the other parts of this equation that really is important to Bay Path and to Bay State is a teaching hospital. That's a huge consideration because that helps to give us our reputation in the region. Arguably, we have the best teaching hospitals in America, in the state of Massachusetts. I mean, not bad. Tufts Medical School, Harvard Medical School, UMass Medical in Worcester. I'm very familiar with physician's assistants and primary care physicians because in southern Worcester County that I represent currently, that UMass Medical School connection is most significant because many of those doctors choose to stay on, and it's become very attractive in that region because of the proximity to UMass Medical. And we want the same thing here for all of you. So with a teaching hospital, understand that the physicians that are trained at Bay State, they have a chance to expand business here because, let's be candid, this is a nice place to live. And once people come here, they really like the region. It's a great place to live. So the medical experiment that we've undertaken is hardly new. So for the critics who always say, well, the government is doing this or the government's doing that, remember, the government does veterans health care, Holyoke Soldiers Home, Northampton VA Hospital, and it's gotten really good, I can tell you that. Medicare and Medicaid. People always think Medicaid, they think, oh, it's only for poor people. No. 1 out of every 3 Medicaid dollars goes to nursing home care. Dementia and Alzheimer's disease. Overwhelmingly, that's where the money goes, to nursing home care. And for people that struggle arduously to keep that loved one in the home, only to discover at some point it's no longer plausible. And they're at that nursing home every single day to visit with that loved one. These are the challenges that confront all of us. So what you're inaugurating here today at Bay Path is so important. And the experiment that you're undertaking is really bold. But you can build upon it because as the Affordable Care Act plays out, you're going to have a chance to shape its future. So this is a really nice opportunity for me with President Leary and with the staff here at Bay Path to acknowledge the role that our academic institutions play in terms of relating to what arguably are the best hospitals anywhere in America. And they're right here in our midst. Thank you all very much.
Thank you. Thank you. I want to thank Congressman Neal for his remarks. And also we'd like to just give you a little gift to take with you to all of your healthcare committee meetings from the physician assistant program here. Yes, absolutely. Thank you. All right. Thank you.
Thank you.
And again, a special thanks for those remarks from Congressman Neal, and especially I think for the support of healthcare here in Hampden County, for physician assistant legislation, and for the positive changes in healthcare reform that can only mean opportunity for every physician assistant here in the county, here in the state, and nationally, and certainly internationally as our profession grows. As everyone knows, there is no victory without a great team. And certainly I have been blessed by a number of people working with me throughout every aspect of the program. I would like to begin, I think really I need to begin, not with the faculty around this grant, but with Janine McVeigh. Janine McVeigh worked with me, I worked with Janine McVeigh. And she wrote, and she wrote, and she called, and she wrote, and it was 3 in the morning, and then it was 5 in the morning, and then it was all day Saturday. I'm home on my iPad sending back answers, and she's home in her living room with sore fingers and probably carpal tunnel syndrome by now. So I cannot thank you enough. You have made this possible. I have lots of great ideas, but Janine made it happen. So please, everyone. Okay, and now the faculty. The assistant director of the program and my right hand and right brain and left brain, Teresa Ritho. The director of clinical education, who will be responsible for all of our students out in the community, Stephen Lee. The founding vision of our program, Dr. Robert Hoffman. Lovingly known as Dr. H. Dr. Sudeep Alak is our medical director, and as a good physician is in seeing patients this morning and couldn't reschedule, but she again has been a great servant to the program and a great help for the development. Again, behind all of those teams is the team manager that keeps me organized. Somehow, Gina Marone, I know you're in here. Thank you for all your help. I appreciate it. We also have representatives from our clinical partners who I am absolutely sure were vital to the success of this grant. Each one of these partners met with me, sent letters of support that we included with the grant, and I am absolutely sure that was a major factor in the award. First person I'd like to introduce is Dr. Kevin Hinchy. Dr. Hinchy is the Vice President of Academic Affairs from Bay State Medical Center. Dr. Hinchy has been incredible support throughout the development of the program. Came to the college, reviewed the curriculum, has been working with all of his physicians, physician assistants, providers to make sure we have clinical placements for our students. So a very hearty thank you from me and the program and the college, Dr. Hinchy. Hampden County Physician Associates are represented today by the Chief Executive Officer, Doug McCall. Doug? And their Chief Medical Officer, Dr. Ari Berman. The Caring Health Center is represented today by Tanya Baker, their Vice President. It's Barbara, I don't have my glasses on, excuse me. Bonnie Paddleford, Physician Assistant. Natalia Lukin, Physician Assistant. Okay, great. And the Tapestry Health Center is represented by the Assistant to the CEO, Tay Briggs. Okay. And Berkshire Medical Center, although a great supporter of the grant, was unable to join us today. So a big round of applause for our partners. So, as you know, this grant is a great opportunity for our students to learn with the physician assistant role models that we have here today. It's a great opportunity for us to allow recruitment of veterans, to allow recruitment for diversity from our classes. We currently are just starting conversation about our veterans admissions process. Stephen Lee has been in conversation with Dean Koenig to develop a committee to support this recruitment. We think this is a great model to allow opportunity for those that have served our country. I want to especially congratulate our students about this grant. First of all, that you're here. Secondly, that you are doing incredibly well and making us proud every single day. Certainly, as you can see, they are poised. They are poised to serve our community, to serve our patients and the surrounding communities, poised to be part of the solution of the healthcare dilemma that we're here in Hampden County. And I do have to say, this grant is an investment in our community, and these students and these soon-to-be graduates will be here serving the patients, living in the community, and enjoying all the benefits of being a PA, which are life-changing. So congratulations. But enough of us, because this is really about the students, isn't it? I'd like to introduce Class President Tom Quapian, who was elected by his peers, to say a few words for us today. Tom?
Hello, everyone. Thank you, Dr. Hickson, for that warm introduction.
Happy to have you.
Ladies and gentlemen, future patients. Congressman Neal, on behalf of the Bay Path College inaugural Physician Assistant class of 2014, I would like to welcome you to our lab, as I like to call it, our launching pad, into becoming part of the solution, which is, of course, the motto of our class. This $1 million grant awarded to BayPath benefits the students, it benefits the school, and ultimately the communities that we serve. It will help to create a lasting legacy of commitment to educating and training superb primary care providers, which is very important. The primary care rotation subsidy for myself, my classmates, and future PA students is greatly appreciated and helps us in reaching our goal of becoming physician assistants. As you know, college is very expensive, and helping the community with providing primary care providers is also a top priority at this time. And as we've heard, the health situation in our region, could be helped a little bit by an influx of primary care providers, which we certainly will be able to help serve that niche. This grant will also help the PA program itself. It will help to maintain a high level of educator expertise and leadership, thereby creating a template of excellence in Western Massachusetts as a model for training PAs. Essentially, BayPath will be looked on by other PA programs all around the country, maybe all around the world, as a model of excellence, and this is how it should be done. Of course, the big winner here, though, is the community, which is to say all of us. Communities better served by adequate numbers of capable, professional primary care providers is the basis for what this type of legislation represents. This proactive approach to our nation's healthcare crisis is a real step in the right direction. Continued legislative support of the PA profession will inevitably result in improved disease prevention and better health outcomes sooner rather than later. Congressman Neal, I thank you for your interest and support in this endeavor. And finally, I would like to thank the director, Dr. Hickson, and her courageous, diligent staff for bringing this program to the community and bringing this grant to BayPath College. Thank you.
As you can see, and that obviously was the icing on the cake, BayPath is certainly in good company today. And the Congressman used the word bold twice. Well, I think you know that we define BayPath as a small but very bold college for the 21st century. And we promise you we will continue to do bold things for our community. But this is a partnership. It starts here, obviously, with our faculty and our students. It then grows to the community of Long Meadow, the greater community of Springfield and Holyoke and all of Hampden County, the state, and the federal government. It is a true, bold partnership that we are really celebrating today. And as we conclude, obviously, I hope one or two of you might have a question that either I or the Congressman or Dr. Hickson might answer. But we would like to take any questions before we conclude our day's program. And then naturally, refreshments will follow. So, any questions out there?
Happy to do it.
We're
please.
happy to do it. And if there...
You get to keep the grant even if you ask me a bad question.
Anything? Okay, well then let's celebrate this wonderful grant and a bold